Today we're going to talk about a very serious situation, a malady, anorexia nervosa. Very difficult thing to deal with, mostly afflicts women, and can be very dangerous, life-threatening in fact. And we just want to go over some of the overviews of proper diagnosis and then some treatment goals that are helpful in this regard. So with regard to anorexia nervosa, the American Psychology Association says there are 4 criteria to be met for a diagnosis of anorexia. Number 1, the patient's weight is less than 85% of norm for their age, height, and build. So we've got established norms or range for a particular age, particular height, particular body build, and the patient's weight or the person's weight is less than 85% of that norm for age, height, and build. So if it's less than 85%, that's one marker. The second one is an obsession with weight. The patient obsesses over their weight, that they're becoming fat. They consider weight loss to be an achievement that is directly tied to their self-esteem. The more weight I lose, the better I feel about myself. So less than 85% of norm for age, height, and weight. Obsessive about weight, talking about how they're becoming fat all the time, and the way they feel about themselves is directly tied to weight loss. Not gaining a particular weight, but I am losing weight, and the more I lose, the better I feel. 3, body image. If the patient's body image is distorted, they consider themselves still overweight when they are clearly underweight. Everyone else looks at them and sees that they look emaciated, that they obviously are losing dangerous amounts of weight. But when the person is asked how they view themselves, their body image is, I am fat, I am bloated, I am hideous. And that's just not the case. So we've got their body weight being less than 85% of what's normal for age, height, and weight. They obsess over weight, thinking they're always getting fat. They feel better about themselves the more they lose. Their body image is skewed so that they think they look fat even when everyone else can tell that they are underweight. And then finally, when female, which anorexia nervosa seems to almost exclusively target females, they miss 3 cycles, menstrual cycles. They've missed 3 or more menstrual cycles, so perhaps in a row there basically. So they have lost weight to the point that their body is shut down and is no longer keeping that normal rhythm, that normal cycle going. So if they've missed 3 or more menstrual cycles, a body image that is not in line with the way everyone else perceives and sees them, an obsession about weight, and their actual weight being less than 85% of norm, the American Psychological Association says that a diagnosis of anorexia nervosa is called for in that case. Now when we think about treatment goals, how you can help someone who has this diagnosis, we want to think about these things. The first thing you want to do is work to restore normal weight. You want to restore them to a normal weight. So if this is less than 85%, you got to move them towards what would be normal for their age, height, and weight. Age, height, and build. Age, height, and build. So then after restoring the weight to where it ought to be as close as possible, you also want to restore the menstrual cycle. And as their weight approaches norm, at least in that range, the menstrual cycle should come back. So you need to restore the menstrual cycle. You want to restore normal eating patterns. Normal eating patterns. They've gotten to this point of losing the weight and that sort of thing by adopting abnormal eating patterns. You need to work to restore a normal pattern of eating. And then finally, you have to deal with the underlying psychology, the psychological factors that have led to the disorder. Why is it that you see yourself this way or feel like you're fat or have to feel good about yourself based on losing weight? What are the underlying psychological factors? Body image, ideas of beauty and things like this. So this tells us the proper diagnosis of anorexia nervosa. These are the goals that you're aiming at, of restoring the normal weight, normal eating patterns, the menstrual cycle, and then addressing the psychological reasons that led to the disorder. Things that help in this regard are assertiveness training, appropriate use of exercise, expressive and creative activities like dance and art, involvement in leisure activities, and then a good emphasis on nutritional education. These things all tend to help. So anyway, that's just a quick overview of how to diagnose and some treatment goals related to anorexia nervosa. If you'd like to read or learn more, there's a link underneath this video. Click on that link. It'll take you to a website where you can get more information. And on that website, you'll find a link to an ebook ready for immediate download.